Hi, I'm Denise Smith, Professor of Health and Human Physiological Sciences at Skidmore College, also a research scientist at the Illinois Fire Service Institute, and I've also conducted several fatality investigations for the National Institute of Occupational Safety and Health. Really want to say thank you for seeking some more information on cardiovascular health and cardiovascular disease in the fire service. So it's important to start with what motivates some concern about cardiovascular events in the fire service. The truth is, cardiovascular events are the leading cause of line of duty death on the fire ground. They account for far more fatalities among firefighters than to burn injuries, asphyxiation, or collapse combined. It turns out that firefighters are not at greater risk for all-cause cardiovascular disease than the general population, or at least it doesn't appear so based on large epidemiological evidence. And it looks like firefighters have similar risk factor profiles with the general population, which still means a very high prevalence of obesity, dyslipidemia, and other cardiovascular risk factors. And for hypertension in particular, it does appear that firefighters have a higher prevalence of hypertension. Using a large cohort of firefighters, over 5,000 from across the country, we found that 69% of firefighters have blood pressure values during an occupational exam that would place them in a hypertensive category. So why are cardiac events the leading cause of firefighter line of duty deaths on the fire ground? Well, certainly it's related to the high cardiovascular strain of firefighting. Firefighters perform really strenuous physical work, right? They're climbing stairs while they're carrying heavy equipment. They're crawling down a hallway while they're dragging a charged hose line, or they're rescuing victims, whether through extrication or in a fire. And they're performing this strenuous work while they're wearing about 22 pounds of protective clothing. That's not counting the gear they carry. So they're fully encapsulated. They're wearing a self-contained breathing apparatus, and they're working in a hot and hostile environment under time urgency and with threat to their own health and those that they're serving, protecting in this case. So we have very high cardiovascular strain. We know it involves high cardiac workloads, changes to the vascular system, including increased vascular stiffness, and a procoagulatory state. Following firefighting activity, you have an increase in platelet number and function. You have a decrease in activated partial thromboplastin time. Now, most firefighters recover from this cardiovascular strain without incident. But in individuals with underlying cardiovascular disease, this heavy work and the cardiovascular strain associated with it can trigger a sudden cardiovascular event. And so it's really important that healthcare providers be thinking about and looking for underlying cardiovascular disease. And we need to think broadly. When I say underlying cardiovascular disease, we need to be concerned with atherosclerotic cardiovascular changes, obviously, that can lead to partial obstruction and ischemia, or that can lead to a rupture and a myocardial infarction. But we also need to be really mindful of the damage caused by hypertensive heart disease, not just because it exacerbates atherosclerotic heart disease, but because damage to the heart, structural heart changes, can make the heart more vulnerable to arrhythmias. And there's some evidence that the structurally enlarged heart is particularly vulnerable in the presence of ischemia, which of course could be caused with firefighting. So if you think about those overlapping pathological conditions, perhaps it's no surprise that when we reviewed the autopsies from all firefighters who died in the line of duty in the last 20 years, if an autopsy was available, the data showed that 80% of those who succumbed to a fatal event had both coronary heart disease, atherosclerotic disease, and a structurally enlarged heart, which is consistent with hypertensive disease. And so physicians that are treating or evaluating or screening firefighters would want to think about the cardiovascular strain of firefighting and the vulnerability that that places for someone with cardiovascular disease. And so maybe we're looking more than we do in the general population where the stress is not so great. Now, the NFPA 1582 standard, which is a great place to begin if you're evaluating a firefighter, or to know what a consensus standard is for what firefighters must do, and the medical values, excuse me, the medical conditions that are inconsistent with safely performing that work. The 1582 standards suggest, and I think this makes sense to all physicians, that we begin with atherosclerotic cardiovascular disease risk factor or a risk calculator. So the standard lipid panels, evaluation, and some history on the firefighter is important. Beyond that, you may want to consider an exercise stress test, both to determine the functional capabilities of the firefighter and to detect ischemia, particularly in the face of increased workload. Another thing that many experts are recommending, including a medical advisory team that I participated on as part of the Better Heart Project, suggested that all firefighters over 40 should be evaluated with a coronary artery calcium score. These tests are now relatively easy to perform. They're available in many communities, often at a relatively low price. And it provides a great deal of insight in terms of the presence of disease and the prediction of increased risk for a coronary event. Also, for firefighters over 40 with a history of hypertension or obesity, both of which are associated with structural changes in the heart, it may be wise to consider an echocardiogram. Beyond the screening and the testing, if I could just take a moment and say how important it is for physicians to be counseling firefighters to aggressively manage their risk factors. These are people who are putting their lives on the line quite literally day after day. And just as they care for their community, physicians need to care about them and help provide the motivation to manage those risk factors that are so important. Obviously, this should be done through lifestyle changes, promoting healthy eating, physical fitness, proper sleep hygiene, alcohol in moderation, but also the consideration of medication when it's needed to control blood pressure and cholesterol levels in particular. Thanks again for your concern about firefighter health and safety, and in particular, their cardiovascular health.